Welcome back. Today we're taking a closer look at the growing trend in healthcare communication, texting patients. According to the Medical Group Management Association, 68% of physician offices are using text messages to send out to their patients. That sounds convenient, doesn't it? However, before you start sending messages, it's important to understand the regulations involved, particularly HIPAA and TCPA. Let's tackle the important question: can you text patients? The short answer is yes, but there are important guidelines to follow. HIPAA allows texting as long as you adhere to their regulations. This means training your staff to send out only compliant text messages and giving patients the choice to opt out of their text messaging services whenever. Additionally, it's essential to comply to TCPA, which mandates that you obtain patient consent and limits how many messages you can send in a day. While texting can be a valuable communication tool, maintaining compliance is important. Before implementing a texting system, let's look at the regulations you need to know. HIPAA requires that patient information remains protected, which includes patients' names, birth dates, contact information, and health records. On the other hand, TCPA restricts unsolicited messages. It also allows consumers to opt out of text messaging programs easily and restricts automated messages from being sent before 8 a.m. and after 9 p.m. in the patient's time zone. Now, how do you stay compliant with HIPAA? First, make sure you have consent from your patients before sending messages. Use a service that is HIPAA compliant. You can do this by ensuring encryption and strict privacy policies to protect patient information. If you were found to be non-compliant, it can lead to fines ranging from $100 to $50,000. Also keep in mind TCPA. You must obtain patient consent. They should have options to opt out whenever they choose. Additionally, it is important to text during the designated hours to avoid any penalties. Being non-compliant with TCPA can lead to fines ranging from $500 to $15,000. You can also risk being sued. Now that we've covered necessary regulations, let's discuss what compliant patient texting actually looks like. First and foremost, obtaining consent from your patient is crucial. Before you start sending any messages, make sure that they agree to receive texts. This can be done during their initial appointment or through a dedicated sign-up form. Next, you need to ensure that the texting service you're using is HIPAA compliant. This means it should have strong security measures in place, like data encryption and clear privacy policies to protect patient information. It is also essential to establish a clear opt-out process. Patients should be able to easily unsubscribe from the text messages whenever they choose. This not only aligns with TCPA regulations, but it also helps maintain trust with your patients. Remember, always avoid sharing any sensitive information in your text messages. For example, instead of discussing a patient's diagnosis, focus on things like appointment reminders or follow-up instructions. Now, why should you text your patients? Here are some appropriate reasons to be sending messages to your patients: confirming appointments, sending reminders, following up on overdue payments, directing patients to complete pre-appointment documents, or checking on medication completion. For example, an appropriate reason to text a patient is to send a reminder an hour before a patient's 3 p.m. appointment. This can help reduce no-shows. If they can't make it, they can just easily respond, allowing you to fill that time slot. Finding the correct time to text a patient can seem a little difficult. It is understood that it is best to stick to the normal office hours, ideally between 8 a.m. to 5 p.m. This is when patients are available to read and respond to your messages. Try to avoid sending texts during rush hour, like early mornings or late afternoons. Patients may be commuting or busy with work, making it difficult for them to engage. If you message them during these times, they might miss your message or forget to respond altogether. Additionally, consider the patient's time zone if you are in a different time zone than them. Sending a message at 9 a.m. for you might be outside their normal hours, which may seem invasive. By respecting your patient's time and sending messages when they're most likely to engage can increase the chance of timely response. Now that we've covered regulations, you might be wondering, why bother with a texting service? There are a lot of significant advantages. Automated reminders can drastically reduce no-call, no-shows, plus sending a link for online check-ins can speed up the process and reduce wait times at your office. You can also send out post-appointment surveys, which can improve patient satisfaction. Staying up to date with HIPAA and TCPA regulations not only keeps you compliant, but can also save you money. Texting patients may seem confusing, but again, it can help streamline communication, reduce no-call, no-shows, and boost patient satisfaction. If you want to learn more about how to stay compliant when texting patients, reach out to a Tactics. And since you've made it this far into the video, you might as well like it, share it, and comment down below.